Well, our audience should be online and ready to join us. So welcome to this session on Gender Justice in Disaster, Inspiring Action. The panel around LGBTIQ+ people and disaster. I would like to acknowledge the traditional custodians of the land on which I'm standing today, the Wurundjeri people of the Kulin Nation, and I give my respects to elders, past, present and emerging. And I welcome you to acknowledge the traditional custodians of the land where you are today. Welcome, my name's Donna Wheatley. I'm a Commander with Fire Rescue Victoria, and I've got the pleasure of moderating the panel today, listening into what all our experts have got to offer to the discussion, and enjoy a little bit of Q&A after we've heard from each of them. So you can use the Q&A feature in Zoom to pop any questions in as they come to mind. Participants can vote the question, so when we get to the Q&A, if we've got multiple people interested in that, that can get the preference of first response. So we're going to kick off with Professor Dale Dominey-Howes from Sydney University, a leading LGBTIQ and disaster research fellow. So Dale, I'll throw over to you.
Donna, thank you. Hello, welcome everyone, and thank you so much for the organisers for the invitation to join the panel. If I may, I'll begin by paying my respects to the Indigenous people on whose land I'm located, the Gadigal people of the Eora Nation in Sydney. Pay my respects to their elders past, present and emerging. And note that this is a place they have called home for a very long time. And so it's to home I would like to now turn. I'd like to spend a few minutes thinking about the concept and meaning of home and how the home, when impacted by disasters, may affect sexual and gender diverse people in particular ways. For virtually all of us, the place we call home is hugely important and serves many interconnected functions, but it's certainly much more than simply a place of shelter. Critically, home is frequently thought of and described as a place of safety. It provides a form of ontological security, a way of knowing, being and relating in the world. It's material, emotional, it's imagined. It's a personal representation, an expression of and into the world around us. Home is also an escape from the world out there. It's also an outward facing and constructed reflection of self-identity. Now, research in Australia and around the world demonstrates that this is particularly the case for sexual and gender diverse people, many of whom may have either been rejected or needed to leave their parental and familial homes for a variety of reasons. As you're also well aware, homes are frequently, all too frequently, damaged or destroyed during disasters, making their occupants homeless. But more than just being about being homeless, which is and of itself terrible, the loss of home makes people visible and out there into the open, hostile world. Whilst I'd absolutely acknowledge this process of home loss is potentially traumatising for anyone involved, for sexual and gender diverse individuals, damage to or loss of their home has a range of direct, major, as well as indirect and subtle effects and impacts. At one level, for example, the loss of home can make individuals visible to the heteronormative, and many would argue hypermasculine environments of emergency service personnel, insurance agency representatives, and ultimately building crews who come into the homes to assess damage and determine reconstruction and repair needs. This can very much rupture that ontological security provided by home to sexual and gender diverse individuals. And again, this can play into cycles of repetitive trauma, throwing survivors back into needing to deal with feelings of hopelessness and insecurity that can arise in earlier parts of life cycles. Post-disaster homelessness, whether temporary or longer term in nature, has a range of physical, mental, emotional and identity related impacts on individuals, potentially increasing vulnerability and lowering resilience, making sexual and gender diverse individuals differentially impacted by disasters. All too frequently, sexual and gender diverse people are often found in lower paid, less secure jobs, which in itself can limit their ability to afford safer homes in which to live. This is especially the case for younger sexual and gender diverse people, who once again may have been forced to leave familial and parental homes. They often share houses with others, creating families and communities of choice, all of which are further disrupted when homes are lost. Disasters too frequently amplify underlying structural vulnerability. And we know that in many places, sexual and gender diverse individuals often live in or are located in poorer, more hazard-prone or at-risk areas, again, due to those intersecting issues of education levels, job security and payment. And if you think about case studies like Hurricane Katrina's impacts in queer districts of New Orleans in 2005, or the 2011 Queensland floods, which disrupted community in New Farm in Brisbane, just to look at local and international cases. We know that sexual and gender diverse individuals often live together in shared homes, and when disasters strike, making single or joint claims for social support or insurance can be extremely challenging when authorities are insensitive to housing and arrangements. And sexual and gender diverse people are much more likely to be couch searching and having no fixed address, all of which play into the concepts of the interrelationship between home and disaster. Moving to temporary homes and housing can be problematic for lots of people for different reasons. Too expensive for some, off limits to others. Rules and regulations and management can play out in different ways when people need to move into costly private sector accommodation. Research has shown that sexual and gender diverse people are less likely to have contents insurance at all, or inadequate cover at best for their home and contents, again amplifying loss and impacting recovery. Typically, as you know, most disasters can be thought of as sudden onset with distinctive response and recovery phases. But the current COVID-19 pandemic, as an example of a prolonged disaster, continues to impact all people. Some of my fellow panelists are going to be referring to COVID issues as they relate to sexual and gender diverse people, but I just wanted to flag this issue here, that COVID's had, as a disaster type, profound impacts in terms of housing security, loss and homelessness for many sexual and gender diverse people. As Andrew Gorman-Murray, a good colleague of mine and others have noted, sexual and gender diverse experiences of home and loss in disasters is complex, nuanced and needs far greater research and policy attention. And that's probably brought me to my 5 minutes, Donna. So thank you very much.
This means not shaking hands or exchanging. Thank you so much, Dale. I'm just very mindful that there's some background noise here, so I hope that's not interfering too much at the other end. I'll now introduce Liam Leonard. Liam is going to talk to us about COVID-19 restrictions, some key findings from a literature review on impacts history and lateral violence, and heterogendering of empathy. Thank you, Liam.
Thank you, Donna. I too would like to acknowledge the traditional owners of the land that I'm on today. That's the Wurundjeri people of the Kulin Nations, and pay my respect to elders past, present and emerging. As Donna said, in the next few minutes, I want to give you just a taste of some unpublished results from a desktop review I did on the impact of COVID-19 restrictions on LGBTIQA+ people. And I want to finish with just some meditations on what I'm going to be calling the heterogendering of empathy. The report that I'm talking about was commissioned by Respect Victoria and carried out by Drummond Street Services and led by Beth, who'll be talking and following on at her wonderful team. The desktop review really was a quick and dirty look at Australia and international research and reports on the emerging impacts of COVID-19 on LGBTIQA+ people. We did the work really in June, July last year. Beth will be talking about the focus group interviews with LGBTIQA+ people and service providers about their experiences. And I think she'll also be looking at, in more detail than I will be, at how intersectionality impacted on different groups of LGBTIQA+ people. So I want to run through 5 or 6 findings from the literature review. The first was around human rights abuses. So according to the United Nations, a number of countries use COVID-19 as an excuse to pass public health measures that targeted LGBTIQA+ people. I've just pulled out 2 examples. In Hungary, they passed measures that prevented legislation for trans and gender diverse people to change their birth certificates, while in Poland, similar public health emergency measures were used to enact anti-pedophile laws banning the teaching of same-sex education in secondary schools. While things are not as extreme in Australia, Equality Australia, which is the peak representative legislative body or legal body for LGBTIQ people, expressed concerns in mid-2020 that the current COVID crisis could result in essential LGBTIQ+ reforms being delayed. And they focused on 2, and that was the removing of legal barriers to accessing gender congruent identification and the stopping of forced or coercive medical practices towards intersex people. The second issue that came up in international literature was what I'm going to call the trauma and the weight of history. For many older LGBTIQA+ people, the reporting of COVID really just brought them back to memories of the reporting of HIV and AIDS. There was talks of daily death rates, infection rates, quarantine. There was a heightened discrimination and fear. For, I think, not just older LGBTIQA+ people, but right across the age spectrum, there was also resistance to public policing, which had increased during COVID, given that many members of our community have very bad historical and ongoing relationships with police. There were issues around the use of public surveillance apps and testing, again, a resistance on the part of LGBTIQA+ people who found many of those interventions previously were not used for their benefit. And for some of us, particularly I say in Victoria, but across Australia, we'd had 5 years of public scrutiny. There'd been safe schools, marriage equality, and now the religious discrimination bill. And COVID-19 just felt like the next in a series of national disasters. The third is the disproportionate impacts of social distancing. Early on in Australia, the definitions that were used at the beginning were heterosexist definitions of family, partner and dependents, which made visiting under COVID-19 restrictions quite complicated. And many LGBTIQA+ people didn't have access during lockdown to their supported networks, which, as Dom, if you said in the first presentation, is extremely important for LGBTIQ+ people who may not feel valued at home. The third issue was safety. Many young people, in particular queer young people, found themselves returning to transphobic and homophobic family environments because of loss of income, student support. And many of these people had left those domestic environments because they were violent and hostile. The fifth is lateral violence. We found that within the LGBTIQA+ community, some people were using social media to vilify other LGBTIQ+ people, including, people who weren't getting tested, people who were still having their sexual and social partners round. And the sixth thing that came out, which I know Emily might talk about, I'm not saying you will, Emily, but is to look at LGBTIQA+ sector capacity. A lot of LGBTIQ+ organisations rely on volunteer labour and intermittent sources of income, and they collapsed during COVID-19, and there was no long-term plan for government support to pick them up post-recovery. The second thing I want to talk about very briefly is just something that's gone through my head in the last year working in this space, and that's what I'm going to call the heterogendering of empathy. Now, in November last year, I was part of a Prevention Violence Against Women conference run by the DVRC, the Domestic Violence Resource Centre. And we were asked at the end of the presentation, a panel presentation on the impacts of COVID-19, about what we'd learned from our work during lockdown that might actually improve things around social justice in the recovery phase. And one of the things that struck me in the emerging research on the impacts of COVID-19 was how many Australians who had never experienced high levels of insecurity, anxiety as part of their everyday world, suddenly found themselves experiencing high levels of anxiety, self-surveillance, worried about contact, paranoid about going out, and that this has become the norm for a whole set of Australians who'd never experienced it. It dawned on me that for many minority populations, including women, Aboriginal and Torres Strait Islander people, people with disability and LGBTIQA+ people, we live our everyday lives under disaster-like conditions. We live with a heightened sense of anxiety. We live with a continuous fear of surveillance. And I thought there was an opportunity with COVID for a mainstream privileged group who've never understood that to reflect on their own experiences of the new norm under COVID and perhaps have a greater understanding that that is the everyday life for many minority people outside of COVID. However, in the last 2 weeks in Australia, there's been pushback and a regendering in my head of empathy. And I pulled two quotes, and that's where I'll stop. The first is Linda Reynolds, who's the Federal Minister for the rollout of the National Disability Insurance Scheme, who was reported on the ABC 2 weeks ago as actually saying, the National Disability Insurance Scheme is too reliant on individual public servants' judgment and their natural empathy, as she defended the government's controversial proposal to introduce independent assessments. And those of us who worked in the public service, that's rarely do public service get accused of empathy. And the second is Peter Dutton, our Minister for Defence, who is reported to have sent a directive to our armed forces last week to stop holding morning teas which celebrate diversity and inclusion, a directive to believe to be in direct response to the armed services celebrating Ida Hobbit Day. And a month earlier in April, the Liberal backbencher Philip Thompson said the new Defence Minister, Peter Dutton, was making sure that the ADF focused on its main tasks. And the new Assistant Defence Minister, Andrew Hastie, made it clear what those key tasks were, the application of lethal violence, and warned that mission clarity was vital to their work. So for all of the possibilities of opening up empathy, I think we see again the heterogenting. I think this is about a hypermasculine behaviour and a pushing back of empathy as somehow feminine, secondary and not primary to policy and work. So that's it.
Thank you very much, Liam. Some great insight there, and I know we're going to get to some Q&A, and I think that there will be some roundtable conversation about some of those points that you've brought up. You mentioned that you had worked with Beth, and Beth McCann is the General Manager of the Centre for Family Research and Evaluation at Drummond Street Services, and Beth is going to talk to us a little bit about this COVID-19 interview data and this report. Over to you, Beth.
Hi, I'd like to begin by acknowledging I'm also on Wurundjeri land, and I'd like to acknowledge that sovereignty was never ceded of this land, and Aboriginal people maintain strong connection to the land despite colonisation and in the face of colonisation. So I'd like to acknowledge the resilience and strength of Aboriginal people. So we're lucky to be an applied research centre based within a social services organisation. We work with a number of LGBTIQ people through our queer space and queer space youth services. And so this formed part of applied research that we've done specifically in the area of LGBTIQ family violence for a little while now. And we were lucky enough to work with Liam and the GADPod on the project, so bringing in that disaster lens to some of the LGBTIQ family violence work that we've traditionally done. It was funded by Respect Victoria to look at family violence primary prevention with a disaster lens over it. So looking at what primary prevention messaging should potentially look at during COVID-19, were there specific things that needed to be taken into account, and what were the implications in terms of future disasters. As Dale spoke about before, often disasters are quick, and often what happens is people lose their homes as a result of disasters. COVID-19 has been very different. Instead of losing their homes, people were stuck in their homes. For many people, they were stuck in their homes with violent situations, young people moving back to violent situations, or homophobic, or families that didn't accept who they were, so hiding their identity. A few people told us that they went back into the closet. And we know that young people were particularly at risk. So in addition to the project that we ran with Liam and the GADPod, we also did some data analysis for Equality Australia, looking at their national survey, focusing specifically on family violence during COVID and some of the impacts of that. And young people were 4.3 times more likely to experience family violence than other LGBTIQ cohorts. So we know that they were particularly at risk during that time. We also saw that there is a huge range of diversity within LGBTIQ people and communities. So we spoke to, as part of this research, to 42 participants. 13 of them were service providers from a broad range of organisations and 29 community participants. And we saw the impacts on the participants and on the service providers working with LGBTIQ communities were really diverse, depending on the intersecting communities and marginalisations that people from LGBTIQ communities face. So there were some communities that were particularly at risk. Trans and gender diverse people, we know, face discrimination with workplaces and with education, and often are in insecure work as a result. They were the ones that were often quick to lose jobs. We saw young people who were losing jobs and moving back with families of origin. We also saw changing dynamics in relationships, which were quite interesting as a result of job losses, which often changed relationship dynamics within a relationship. And we saw social isolation was a huge factor, which cut a lot of people off from their communities and networks of support. And for those people who were living in unsafe environments or environments where they didn't have supportive families, that can be seriously damaging and problematic. So being stuck at home with people who you have to hide your identity from is seriously damaging, and not being able to go out to those safe networks and networks of support, not being able to engage with people who give you support and validate you for who you are, was severely damaging. We saw when we did interviews, we did some interviews with our practitioners during COVID, and there are a huge number of issues that came up. So what we saw was that existing issues were magnified. People from low socioeconomic areas were more exposed to the virus. They had to leave their homes. They also were over-policed, and often it was low socioeconomic areas and people from different racial backgrounds and racial minorities who were targeted by police in terms of fines, which were disproportionately impacting those communities. For LGBTIQ people, we know that there are issues in terms of mental health, lower job security, job loss. So these issues were magnified during COVID. Sorry, I'm getting a little bit tongue-tied. I might stop now because I think that's probably my 5 minutes, but feel free to ask me any questions during the Q&A and I'll take it from there.
Wonderful. Thanks so much, Beth. Now, yes, we'll try and keep to the time, but if we're a minute over, we can catch up in Q&A. So I'll now introduce Emily Dwyer, and Emily is the founder of Edge Effect Pacific, Southeast and South Asia. And Emily's going to talk about the Vanuatu and regional context and looking at an evaluation tool, global to local. Thank you, Emily.
Thanks very much, Donna. Yeah, and I guess I want to sort of focus a little bit on why change happens, why change doesn't happen, and how we would know if change is happening within disaster management organisations to be more inclusive of people with diverse sociasks. So hopefully I can sort of move from more conceptual to a more practical within the 5 minutes. As Donna mentioned, we work regionally, and the report that I want to talk about is called The Only Way Is Up. And I will just put after this a link to that report in the chat window. It follows on from a conference that was held in Bangkok a couple of years ago called Pride in the Humanitarian System. And that brought together civil society organisations, or LGBTIQ civil society organisations, UN agencies, INGOs and donors like Australia's DFAT to talk about why do LGBTIQ people experience exclusion in disaster and conflict, and what can we do about it. The Only Way Is Up was commissioned to look at the situation 2 years after that conference and say, okay, well, all these people came together, and then 2 years later, what were they able to achieve? And what we found was that actually not very much, unfortunately, because even though the relationships were really important and were maintained, what people said is an absence of funding, an absence of capacity within organisations, and a lack of priority on LGBTIQ or diverse sociastic inclusion meant that it was really hard to get some momentum toward moving toward change. For the report, we also looked at the global context, so looking at the Sendai framework, the SDGs, core humanitarian standards, those other sort of big picture kinds of humanitarian and disaster standards to see, well, what kind of impetus did they provide for inclusion of people with diverse LGBTIQ people? And often the answer is almost nothing. So there isn't that motivation or incentive there either. We also looked at 3 different countries for humanitarian settings. So Cox's Bazar, the island of Mindanao, where there was the Marawi conflict displacement and earthquakes in the last year or two, and also the response to Tropical Cyclone Harold in Vanuatu. And in those contexts, what we found is that there were profound needs and specific needs for people with diverse SOGIESC along the lines that Dale and others have talked about. But that the assessments by humanitarian organisations, disaster response organisations, rarely acknowledged those, so that they weren't present within the designs, they weren't present within activities. These were activities that were not being funded or evaluated. Additionally, there was a great sort of absence of partnership between humanitarian and disaster-focused organisations and LGBTIQ civil society organisations where they existed in those places. And as Liam mentioned earlier, often those organisations are volunteer-run, poorly resourced. They've got many things they're working on, and they don't necessarily themselves have the experience of engaging in disaster response or working with the kind of language or funding or systems that we might be more familiar with. So a really quick example from Vanuatu. Someone who's a trans woman who said, you know, I made sure I got my family, I helped them to get on the transport to go to somewhere safe. My mum was begging me to get on it, and I said, no, I'm going to stay here. I don't want to have to deal with the discrimination that I know I'm going to face. Other people talked about having their crops or personal belongings taken after the cyclone because there was a sense of impunity that nothing would happen if they did take things from people with diverse SOGIESC. Also, for example, a lack of tailored psychosocial support for people in these kinds of contexts. So why does this happen? So we in doing The Only Way Is Up, we looked at the humanitarian system as a complex and adaptive system. So globally, there are reports by ALNAP, Core Humanitarian Standard, and other groups, which are looking at sort of all of the different parts of these systems. You know, the staff within the systems, the training, the policies, the funding, design, support, all of that, to say, well, why does the humanitarian system often not change? Not just in the context of LGBTIQ issues, but generally. And I guess the answer to that is that it's not a mechanistic system. It's not, you can't like sort of do a workshop, train people, therefore they learn things, therefore it gets better. You know, produce a policy document, people read it, they change what they're doing. That kind of linear kind of cause and effect doesn't necessarily exist. So we need to be cognizant of that and sort of recognise that we need to do lots of different things together to try to change these systems. And in the last minute I've got, I'll just mention a toolkit that we've put together as part of The Only Way Is Up, which is essentially an assessment and evaluation toolkit. Essentially, it involves doing an audit of humanitarian or disaster-focused programs. We have something called a diverse SOGIESC spectrum. So this is often used in the development sector. It sort of rates programs according to whether they, you know, make the situation worse, whether they don't acknowledge the situation exists, whether they acknowledge it in a tokenistic way, whether they acknowledge it in a way which is actually inclusive and transformative. So by taking a look at the organisation's approach, its gender analysis, the sectors it work in, for example, shelter, we can come up with a score against this spectrum. So that creates a baseline, which is really important for knowing where we are and where we might want to move to. Most importantly, however, doing this evaluation using this toolkit requires cooperating with an LGBTIQ civil society organisation. So it's not enough for humanitarian disaster-focused organisations to do internal reports and to evaluate ourselves. You know, we need to work with the LGBTIQ community members as part of the evaluation to understand what the score means and then to work out what to do afterwards. So I'll stop there, but thankfully we are moving on to, I guess, from just a recognition that a problem exists to the fact that you can do things about it. Thanks.
Fantastic, Emily. It seems like a beautiful trajectory for us to be exploring, from the conundrum to some of the solutions. Now I'll introduce JC Gaillard. He's a Professor of Geography at the University of Auckland. Welcome.
Thanks, Donna, and good day, everyone. Kia ora koutou. Thanks for having someone from across the ditch. And let me acknowledge that I stand on the land of Ngati Fatua, who hold the mana for this place. I would like to start with both an observation and a paradox somehow. Nowadays, I guess none of us would argue against the assumption that both disasters and gender are social constructs. I think this is something which is almost given now. Still, at the same time, we use theories, we use concepts, including the very concept of disaster, including vulnerability, resilience, all of these concepts we use on a daily basis. We use methods, we use categories, men, women, and even LGBTIQ. I will leave the plus for later, probably. We take all of these for universal and we roll them out all around the world in very diverse social, cultural contexts. And that seems to me antithetical. How can we think that disasters and gender are social constructs and at the same time apply the very same set of concepts and theories to understand them? I could almost stop here and leave it up to you to ponder upon this paradox. If we have more time, do we have more time? I can carry on a little bit. That may seem at first like a sort of airy-fairy academic concern, but I believe that it's not. I mean, it's an epistemological nonsense to me, but it's more than that, because it matters on the ground, and it matters on how disaster risk reduction, because we roll out all around the world the same approach to understanding and reducing the risk of disasters. And that may take the form, for example, of these matrices like the hazard and vulnerability capacity analysis that are all based on the same men and women categories and break down vulnerability into whatever physical, social, cultural, as if all of these applied all over the world, again, in very diverse contexts, and they, as if they were to help us reduce the risk of disasters in all sorts of settings. And we know now from some emerging evidence from all over the world, especially Southeast Asia and the Pacific, that such a standardized view of what disasters and gender are do not fit the reality on the ground, especially for societies where we have identities that do not fit the so-called male-female binaries. And I'm referring here to Binabai in the Philippines, Waraya in Indonesia, Fafafine in Samoa, Fakalaiti in Tonga, even I mean Aravanis and Hijras in South Asia, or Berdash in Northern America. So we're starting to have evidence that such framing and such understanding of disasters do not make sense out of the West. Don't misunderstand me. I'm not saying that these concepts, these categories are irrelevant as such. It's just that it's where you apply them that becomes an issue, especially when you can't even translate those concepts in the local languages. It's the case in most places around the world. Now, so we are facing with this kind of hegemony of Western ontologies and epistemology in understanding both disasters and gender. And that supports on the ground in how we do disaster risk reduction, a sort of imperialist agenda that supports what Cameroonese philosopher Fabien Boussi-Boulaga was calling in French, la vérité impériale de l'Ouest, so the imperial truth of the West. That it's the only one truth that applies everywhere, and this is the truth, the reason of the West. And that puzzles me. And that puzzles me especially in an academic environment and in an environment for practice where we again consider disasters and gender social constructs. There's a paradox there. So my whole point is that ultimately, I mean, we need to open up spaces for for diverse views of what disasters are, if the very concept makes sense in the first place, what gender is, and how both intersect in very diverse contexts around the world. And my hope and my optimism somehow is that gender is a good place to start. Gender is a good place to start because in gender studies, and I come from disaster studies, not from gender studies, but in gender studies, you have people like Butler, you have people like Wittig, you have people like Delphi, like Oyewumi, who have challenged that view of gender based on dimorphism, based on biology, and that we need to reconsider what gender is in the first place outside of sex and biology. And we should apply that and extend that to our understanding of not only gender in disasters, but disasters at large. And I think this is a very, very good and healthy space to start that kind of, I would call it post-colonial disaster studies agenda that some of us have been for the past 2-3 years. But I think gender is a very, very good place to start. And there's hope in that space. So that's all for me from now. Probably a bit more political and polemical than my
I love that, Jason.
Good forward. Thanks.
Thank you. We always like a little bit more, and what a great note to be finishing on to talk about optimism and hope. But you definitely brought the paradox in about, you know, we want to get to tangible outcomes about improving these systems with frameworks, and then you blow it out of the water with, well, frameworks around what. So one of the questions that came up about, what do you mean about the plus, JC? Did you said you would say something later about, or maybe leave out the plus.
To me, the plus is, I mean, would stand for the identities that do not fit the others, right? And the others being largely driven by Western thoughts. Everything that doesn't fit within all of the categories would be the plus. And the plus is the sign of hope for me, because we could bring in all of the identities in there. Yeah, that was me. Chiefs.
Beautiful. We had, there was a comment there about patriarchy seems to be so damn resilient. I definitely agree. It seems to keep holding, even though people are trying to challenge that and to stretch our frameworks and understandings. One of the early questions that we had come in was, will marriage equality prevent homophobic discrimination? Is hope in generational change well-founded or delusional? Was there somebody who felt inclined to jump in about that? I think that's a great question. Is that going to be a pivot point for us?
Well, if I may, I'd like to make a comment to open the response. I don't think marriage equality in and of itself will prevent discrimination. And I guess my response would be, what constitutes discrimination under law or policy or process versus the lived day-to-day experience. So whilst legislation and policies can be enacted which move us towards less discrimination, be it in the workplace, in civil society, discriminatory behaviour, which is about the actions of people in places directed towards others, is perhaps something that is harder to change and which we need to engage in dialogues with, and to encourage better human behaviour towards other people. So I don't think equality, marriage equality in and of itself is going to change discrimination. But I do think, I have to have hope in intergenerational change. I have to believe that as a civil society we are moving towards, albeit painfully slowly, a more inclusive and respectful society, personally.
I agree with you, Dale, and I think that these sorts of conversations are a place where we re-engender the hope and you know, the understanding that there are many people working in different ways around trying to progress these challenges. Now, JC has said that he's happy to answer this question live, and we've had enough vote on it. What are the most harmful binaries of thought that damage L plus communities during disaster? I think we've got extra letters in there. JC, did you want to jump in with a reply there?
Yeah, I didn't want to click answer live for all of the very good questions that were raised in the chat. No, I think viewing the world as, I mean, through binaries is a very Western thing. I'm not saying that there are no other societies that view the world through binaries, but it's very, very consistent in the West. And it starts with a very nature culture binary that underpins how we look at disasters. The interface between hazard and vulnerability. This is another binary. But I mean, Ulster in the early 1970s, in the context of gender, was putting the men-women binary within the nature culture binary as well, right? So this is something which is underpinning a lot of our other understanding of diverse issues and concepts. It could go towards the binary between the North and the South. That to me doesn't make sense. The binary between local / indigenous / traditional knowledge versus scientific knowledge. And we could carry on and carry on. I've got a book about to come out, which is all about debunking all these binaries. So I could go forever about this, but I think there are other views, and actually the term view is an issue. I mean, Oyewumi in her book, The Invention of Woman, for example, uses the word world sense or world senses to go beyond just viewing the body as the basis for differentiating gender. There are other senses, other ways of apprehending the world that may help us go beyond these binaries, which I think underpins a lot of the issues we are dealing with.
And I think you're right. These are topics that we can dive deep into literally for days. And good plug on the book. I see a comment already saying let us know about that in the meeting notes at the end there. So with just 1 minute to go, maybe I'll jump to the question. Beth, you spoke about over-policing of marginalised groups. What needs to happen to prevent this? Did you want to jump in there with some thoughts of yours on that one before we close?
Yeah, sure. I think it comes back to this patriarchy seems so damn resilient comment. And it kept coming up in the research that we're in a patriarchal society, and the patriarchal society not only means that there's gender inequality, but there's homophobia and heteronormativity, there's cisnormativity and transphobia, we have racism, we have ableism, we have ageism. We've got multiple forms of discrimination that happen at structural levels, and they're within systems, structures, organisations, and they play out at the individual level as well. So what we need, in my opinion, is things that challenge these norms within society that can be really harmful and damaging to all people who fit into marginalised identities, and particularly where there's intersecting marginal identities. And unless we take an intersectional approach to looking at patriarchy and challenging and going up against patriarchy, unfortunately Liam's comments earlier about some political comments made recently don't fill me with a lot of hope and optimism, but I think it's a collective for everybody. So it's in our structures and systems, but it's also in our individual attitudes and norms and the way that we behave. So there's training that would need to happen, but there's also some structural things that need to change at that level, which dictate why police over-police particular marginal identities. There are different forms of discrimination and different biases and that might be intentional or not that are held. And so I guess it's as much as we can trying to change harmful norms within society.
Absolutely, and what an affirming call to action that we can all take out from here. I always feel like these conversations are the tasting plate about what I want to dive deeper into. So we'll be all heading out to find out a little bit more, to challenge ourselves individually, to have a look at the systems within which we work, and to support each other in the community to keep this work going. I really want to thank all of our presenters, Dale, Liam, Beth, Emily and JC. A wonderful, thought-provoking conversation. For all of our viewers, if you could take the few seconds that it'll take to do the survey that pops up when we sign off. That would be most appreciated so that we can be responsive to people's feedback. Thank you so much. Continue doing the work that you're doing, make the world a better place and be well. Thank you.